Ever looked at your nails and thought, they're looking a little sad? Turns out our nails are like tiny health detectives, and today we are solving the mystery of what they might be trying to tell us. Changes in color, texture, or shape can sometimes reflect nutrient deficiencies or other imbalances in the body. In today's video, we will check how to read the signs your nails might be giving you and what nutrients or health issues could be involved. Let's get into it. Our body needs a steady supply of vitamins, minerals, and protein to maintain healthy nails, skin, and hair. When we are missing key nutrients or going through physical stress or illness, our nails may start showing visible signs: brittleness, ridges, discoloration, and I often ask my clients to pay attention to these early signs since they can appear before anything shows up on a lab test. So let's walk through some of the most common nail changes and what they could mean. These small white spots on your nails, while they are often caused by minor trauma, they can occasionally reflect low zinc or protein, especially if they show up repeatedly without an obvious reason. Zinc supports cell repair and nail growth, and interestingly, diet high in refined carbs may actually reduce zinc status over time. So what to do? Include more zinc-rich food like pumpkin seeds, seafood, grass-fed beef, and nuts, and cut back on overly processed foods and that deplete nutrients. If your nails are thin, break easily, or split at the ends, it could be a sign of low iron or possibly magnesium. Iron deficiency affects oxygen delivery to nail tissue. Magnesium supports protein synthesis and overall nail integrity. What to do? You can plan some blood tests to check your iron and magnesium status because maybe you need supplementation. When it comes to nutrition, you can add more iron-rich foods like grass-fed beef, lentils, leafy greens. Boost magnesium with nuts, seed, dark chocolate, and greens. If you've got digestive issues, it might be worth supporting your gut or trying digestive enzymes, because absorption really matters here. Vertical nail ridges are often a normal part of aging, but if they become more pronounced, they may suggest low protein intake or vitamin B12 deficiencies. This comes up a lot in my consultations, especially with people following plant-based diet. What to do? Eat more high-quality protein. Eggs, chicken, fish, tofu, legumes. If you are vegan or vegetarian, check your vitamin B12 status and supplement if necessary. If your nails are curving upward, almost like a little spoons, it could be a sign of iron deficiency anemia. Low iron impacts red blood cells and oxygen transport, which affects nail shape and strength. What to do? Check your complete blood count and ferritin level. Eat more iron-rich foods, beef or chicken, lentils, and beans, and pair them with vitamin C-rich foods like citrus or bell peppers to enhance absorption. Also remember to avoid tea or coffee with meals. They can block iron uptake. The horizontal nail lines, also called Beer's lines, often appear after a period of illness, intense stress, or nutritional deficiency. In my experience, zinc or protein deficiencies are common culprits, but high fevers or infections can also lead to them. What to do? Look back. Were you sick or under serious stress a few months ago? Focus on recovery with balanced meals, especially ones rich in zinc and protein. If your nails bend easily and feel too soft, people often think it's a calcium problem, but it's usually more complex than that. Low protein intake or absorption issues, vitamin D deficiency, or even thyroid issues can cause this softness. What to do? Get regular sunlight, or better to check your vitamin D level and take a vitamin D supplement if needed. Eat more protein-rich foods. Consult with doctor to diagnose or to check your gut health, and do thyroid hormones tests. Yellow nails are usually due to fungal infections, especially if they are also thick or brittle, but sometimes they can be linked to chronic respiratory issues or liver dysfunction. If there is yellowing of the skin as well, that's something to get checked. What to do? For fungal infections, try topical treatment or speak to a healthcare provider. For liver, get an ultrasound of your abdominal organs and liver enzyme tests. A bluish or purple tint in your nails, also known as cyanosis, can signal low oxygen levels in the blood. This may be linked to iron deficiency, poor circulation, or even underlying heart and lung issues. What to do? Check your complete blood count and ferritin, increase iron-rich foods to support oxygen transport, stay active to improve circulation, and definitely seek medical advice if this continues. The lunula is that little half moon at the base of your nail. While it's totally normal for some people to have small or hidden lunulas, a sudden disappearance could point to poor circulation, liver issues, or even signs of metabolic syndrome or diabetes. What to do? Support heart and metabolic health with omega-3s, fiber, and liver-friendly foods, and keep an eye out for other signs like fatigue, changes in blood sugar, or skin issues. Seek for medical advice if needed. So, our nails offer subtle but powerful clues about our internal health. If you are seeing unusual changes, it could be your body's way of saying, hey, something is off. So take a closer look. Maybe it's time to adjust your diet, check your nutrient levels, or talk to your doctor. Have you ever noticed a nail change that turned to be something deeper? Let me know in the comments. I would love to hear your story. If this video helped you, give it a like, subscribe, and share it with someone who never thought nails could be this insightful. See you in the next video.